Monday Special Town Hall. Tunaomba radhi hapo kidogo, tulikuwa na matatizo ya mawasiliano. Sijui kama ni joto la Mombasa limenilemea, pia limelemea mitambo yetu, lakini wacha tuzidi kupata maswali kutoka kwa wananchi hapa. Mariam.
Jina langu ni Mariam. Mimi ni mkazi wa Mombasa. Hii naelekeza kwa gavana wangu. Niko pale Coast General na mimba miezi 7 na mtoto wa miaka 4 amevunjika mguu. Ninatoka emergency, ninaenda kulipa ninio M-Pesa. Sina M-Pesa, kwa nini? Toke nje niweke M-Pesa nirudi nikalipe M-Pesa, ningoje nipate message, alafu nimbebe tena mtoto, nirudi tena nende nikaone daktari, niandikiwe kwenda kupiga picha, nirudi tena kwa M-Pesa, nipate message, nikirudi foleni imeenda hivyo mpaka ikifika saa 7 saa 8. Hakika niko taabani sana. Sijui swala hili unalichukulia vipi?
Sawa. First of all, acha nikwambie. Sababu tulisema ulipe na M-Pesa ni kwa sababu tunajua M-Pesa uanga iko wapi mfukoni. Simu kitoa from whatever point that you are unalipa. Tuliona hiyo ni rahisi. Sawa, nakubaliana natoka rural.
Yeah. I'm coming from I don't know even hizo vibanda. Yes.
Oh, you don't know M-Pesa, okay.
Yeah.
Sawa. So I would take that as a suggestion. Sisi we thought to create efficiency ni kuleta nini? M-Pesa. Na pia sometimes we want to minimize ile human interaction na mambo ya pesa. So that we do what? Tupigane na ufisadi. Because general, before we introduced the M-Pesa, we used to lose maybe 60% of our revenue. Our revenue has more than tripled when we introduced M-Pesa. But we will take into consideration kwa wale ambaye watu hawana uwezo na ufahamu wa M-Pesa, tutaongea na Safaricom so that they will let agents at all the possibly all the important points at the Coast General, so that huna haja ya kutembea hivi na hivi. Lakini mimi nilikuwa naona M-Pesa ni bora zaidi kwa sababu pesa zipotei. Lakini nimechukua hiyo suggestion. Dr. Kandwala, maybe engage Safaricom to give us more M-Pesa points at the facility. Yule ambaye hana alipe M-Pesa so that we minimize human interaction na mambo ya pesa. Fisadi, kama ufisadi umeenda umekithiri, we will not make progress. Na pesa mtu akiona hivi taslimu nyingi zinafujwa, kuna watu ni wajanja kwa kweli. Unajua wewe you innocent, unakuja hapo, you do not know how to operate M-Pesa. Kuna wale unajua M-Pesa na babake M-Pesa wako pale wanazingojea tu. But we have taken your suggestion, I mean, very very seriously. Tutaangalia tutafanya nini. Mariam, you know you're my friend, you can tell me these things anytime. So wajua hivyo, si mimi marafiki. Niambie anytime, sijali.
Sasa gavana, kuna wengine hapo wanasema kuwa sio mambo na kuwa na agent pale ndani ya hospitali, lakini kuwa kila department, kama mtu anaenda maternity, kuwe na eneo lake la kulipia, kama ni upande mwingine pia kuwe na eneo lake la kulipia, ndio isiwe kila mmoja anaenda mahali pamoja kwenda kulipa.
The point is Mashirima, you are right, but we want to move away from handling cash, boss. Try as much as we can to go cashless, But we get your point that tufanya nini? Accessibility, we will do that. Lakini tutaka jaribuni tu tulipe ina njia ambaye pesa yako hizi potea. Because after all, hii pesa ni ya umma. So mimi I have a responsibility to do what? To protect haki ya umma. But I've gotten your point.
Swali lingine hapa linahusu sera, Michael.
Okay, good morning. Good night. Good night, everyone. Okay. I know it was a good energizer. Good night, everyone. Okay, my name is Michael Nato. I come from an organization, Uhaki na Usawa. At the same time, I'm also a CHW. And my question is going to pertain to issues about CHW. There's a time we met at Red Cross and I presented to you a note demanding for a pay that had not been made about the chikungunya exercise. But that is not the issue. The issue is that you could understand now how we are being mistreated, because this is payment that has not been made since mwezi wa sita, June. Now, what I'm asking, when can you engage us maybe in a round table so that we can discuss all these issues? Because as opposed to Kwale is far much ahead of us on issues of community health workers. And AMREF and SmithKline Beecham made a research, and they said in their research that for the community health worker to be effective, incentives, apart from NHIF, we say thank you, Mr. Governor. But on top of that, the other incentives also that we need to sit down with you and discuss this issue. If it's a policy issues, then our input also should be sought. That is what I want to a clarification from you and an assurance from you that you're going to sit down so that we discuss issues CHW as a stakeholders.
Mashirima, can I request that you leave him with the microphone for a minute, just for 1 minute, and you have my word for the round table. But when you tell me that other countries are ahead of us, you would only be helpful if you tell us what actually they have done. Besides,
let me explain.
We want to learn from.
I did some little research. I'm part of the, what can I call it? Maybe the self-imposed leadership of CHWs in Mombasa. But I did some research. I met even the departmental head of public health of Kwale. And they told us that they have a policy in place, already assented to by the governor. And there are some things that they are doing for their CHWs. They even have motorbikes to move around. That was what I was saying, that there are some things that they are much ahead. Okay. Motorbikes, not motorcycle. So that is what I was saying.
Okay, so tutafutie pikipiki tu. Kazi rahisi. But anyway, the terrain is different because our CHWs, if you're involved in that arrangement, you know very well. The way we have identified our CHWs, they work from where they live. So sometimes hata ukichukua pikipiki labda ndayo kazini la Ford yafanye pale pale. But we have taken your suggestion. But you also would appreciate that this is a conversation that has to, to continue between ourselves and you guys. Simply because we are assessing on how we appreciate your contribution. For example, when other people walikuwa na stereotype story ya chikungunya, you worked with us to eradicate. Larviciding, hizo story, fumigating, you guided us. Wakati watu napiga story, you are on the ground working with us. We truly appreciate your contribution. So we will sit with you and see what is it that we can do. Isipokuwa tu mipango ya pesa nayo pia ni shida, but tutaongea.
Okay, we can come back for the final question.
Swali tu sio la kulipwa kwa wale wahudumu wa afya wa kujitolea. Kuna wengine pia wanataka kulipwa.
Kila mtu anataka kulipwa.
My question is, we have students who have already completed their training in clinical medicine. The requirement in our course is that once you complete your studies, you have to go for 1 year internship in a government hospital. Recently, the government rolled off a program of, let me say, appreciating, or it's an award or a stipend to students who are doing internships in other counties. But it is so different here in Mombasa because our interns, our clinical medicine students interns are not getting something. What do you say about that, Mr. Governor? Thank you.
Makofi yamepigwa kweli kwa sababu mambo yamalifu. But let me say this. First of all, it's a national policy issue. It requires probably the COG and the national government to engage. But I can tell you, and understandably so, because of the progress we have realized so far, we're overwhelmed by the number of students that want to come and intern in Mombasa. Everybody, and because we've developed a retainer policy, so that if you come, do your internship here, we feel that you somehow belong here, and we want to invest in you. But what you have suggested requires a national conversation. we cannot do this in isolation as a county. As Sisi, we model on how we're going to do interns because it's a countrywide conversation. But again, like I said, I have taken that sentiment very, very seriously, and I will engage my colleagues at the Council of Governors together with the national government and our guys here tuone the kind of incentives tutaweza kuwapatia so that mupate hiyo marupurupu in Kiswahili inaitwanga.
So we get the last question.
But we will talk to you, and in fact let's organize a meeting. Kandwala, let's talk to them, pick their issues, see tuangalie.
Yeah.
Wilson Ocheng atatufungia awamu yetu ya maswali.
Thank you very much. My name is Wilson Ochieng from Kisauni. My question is directed to the director for KEMSA.
Finally.
Mr. Manjari. Nilikuwa nataka kupumzisha governor bana, umeongea sana.
You should have more town halls with your people. It seems that they have a lot of things to ask you.
But exactly. You know, they get excited when they see Citizen TV. People have watched Mashurima Kapombe kwa TV leo mona live. They want to impress her.
Asante. So, Mr. Manjari, is there any way that you guys can be able to standardize the prices for medicine? Because honestly speaking, it's really eating into our pockets, because now you go to this hospital, you get that the prices are this much, and then you go to this other person, the price is also this much, and then you go to another person, the prices differ from place to place. And then also the issue of fake drugs. What are you guys doing about it? Thank you very much.
Yeah, thank you very much for that question, and I also want to appreciate the governor and confirm that the issues about KEMSA have not been raised, simply because Mombasa County is doing very well with KEMSA. Having said that, the issues of pricing of medical commodities, that is actually a conversation that is under another body, that is the Pharmacy and Poisons Board and KEBS, because they are the ones that regulate the importation of medicine in this country. But what we do as an organization, when we are doing international open tenders, all national open tenders, we go for the lowest evaluated responsive bidder. And as we do that, we also engage with the manufacturers to realize lower medical prices of medical drugs. But as we are saying this as an organization, we buy in bulk. So by doing that, we are able to realize the best prices and competitive in the market. On the issues of fake and counterfeit, that is not a role of KEMSA. It is a role that is being done by another body. But I want to confirm that every commodity that is in KEMSA has undergone quality assurance, and it is of the highest quality, and every mwananchi should not get worried. Our products are labeled KEMSA, and if we have an issue of advanced drug reactions, we take them back, and at the cost of the person who supplied. I also want to confirm that we will be able to avail medical products and technologies and avoid stockouts in the organization. And as I said earlier, we are expanding our medical products in the organization.
All right, so we risk being here for the whole night, so we're going to bring this to a close, but I want to just get some final thoughts from up here, and we'll start with you, Banawali, if you can just go around like this until we finish here with the governor.
Yeah, okay.
Please make it brief. We need to go home.
Yeah, so I think universal health coverage is the right way to go, because that is what is going to guarantee social cohesion, and that has been proved all over. So this is the right discussion that we need to continue having.
Thank you very much, Alfred.
Okay, young people need to be part and parcel of this conversation, and I also want to give a big shout out to Kenya Youth and Adolescent SRHR Network for actually championing for this and being in the forefront, joining hands together with other young people from all over the country to ensure that we realize UHC in this country, and specifically in our county 001, Mombasa. Thank you.
All right.
As we come to a close, and I want to thank Citizen and Royal Media Services for partnering with us for the 4 activities that we have done with you, and we'll continue engaging and discussing. As we do that, I also want to thank the county governments for agreeing to have this conversation. It has actually opened up, and as you've seen, the Mwananchis are engaging the governors very directly, and we are very proud to have been part of that. But as we achieve UHC, we want to say, leaving no one behind, so that every Mwananchi will be able to get affordable, accessible, and of good quality in this country.
Bwana Governor, your
well,
final
there's just thank you, citizen, for this important opportunity, and to thank the participants this evening, because they've done very well, picked on pertinent issues, very objective questions asked, and I am glad that we have this opportunity. Just to confirm that we are preparing ourselves for UHC. It's important that everybody has access to quality care. We have made progress, but without a doubt, there's a lot more that needs to be done. There's a lot more that needs to be done, but we're on the right track. So for me, it's to appreciate the support from the private sector, support from our citizens, because without them, we would not be here. And their contribution is very, very important to us. And that's why we're progress. And that's why we had time, would have spoken. I wanted to touch on the mortality, maternal mortality, because somebody said 30, almost 30%. I can tell you Mombasa is at 170 over what? 100,000. The national one is 400. So we're doing very well. Sisi tuko mbali sana. Yani 170.
National, I think it's 262, yeah.
262 probably. Sisi tuko 170 kwa laki moja. National is what? 270. Yeah. 270 thereabout. So tuko vizuri. So, but let's keep talking, huh? So asante Joe Ageo.
All right, and we shall keep talking, which is why we'll keep having these conversations every Monday night to discuss different issues that matter to the country. And universal health coverage is indeed one of those big issues that we are discussing in the country, and we will be here every week to try and put that in perspective. My name is Joe Ageo. It's been a pleasure having you, and my colleague is there to give the final bye-bye from Mombasa.
Na asante sana Joe Ageo, na kwa wote ambao wameweza kushiriki na kutuma jumbe. Kuna nyingi ambazo zilitumwa, kulikuwa na maswali yaliyotumwa, nadhani gavana ataweza kuyajibu kupitia mtandao wa Twitter ama kupitia njia nyingine. Amesema mnaweza kumpigia simu, amekuwa akipokea simu. Naitwa Mashirima Kapombe, usiku mwema.